One of the major gaps in the living donation literature that we were really focused on was that most of the literature focuses on kind of barriers to donation from the side of the patients or the providers or even the system level barriers. But we know much less about uh, from the side of the donors themselves. So we wanted to address that. And then the other major gap was that what we do have from the donor's perspective is typically done in very small focus group samples or outside the US. And most of them primarily focus on financial barriers to donation. But we want to think about some other interpersonal and kind of barriers to donation, and also seeing how these factors that influence people's willingness actually translate into steps taken down the donation pathway. So, talking to a center, being evaluated, or actually donating themselves. So the survey itself and the data that we draw from is called the Family of Renal Patients Survey. So this is a online survey that was done in 2019 in two different waves. We focus specifically on the second wave, where we both ask about barriers and willingness to donation and steps on the donation pathway. So we have about 600 US participants that are identified as having relatives with weaker failing kidneys. And we asked them about 14 specific factors that might influence their willingness to pursue living kidney donation. These that include the relationship to the recipient, their perceived ability to extend the recipient's life, their likelihood of being a match for this person, concerns about the surgery, as well as financial considerations. But we also did not just measure willingness. Like I said, we have a measure of steps taken towards donation, specifically whether they had had a discussion with the potential recipient, whether they had agreed to undergo evaluation, whether they had been evaluated, had been approved, and if they had donated. So we use regression based models, and we found that one, interpersonal and health related considerations were the strongest predictors of action, um, and that the donor recipient relationship and belief that the donation would extend the person's life, as well as perceived likelihood of being a match, were all significantly associated with progressing further along the donation pathway than other factors. Um, Interestingly, we find that financial concerns and worries about the surgery were common, but not significantly associated with actual steps down the donation pathway. But the findings really suggest that counseling centered around relational and health related motivations tend to really drive actions. So prior to evaluation, it would be important to explore donor recipient relationships, and acknowledge that, interpersonal closeness might be motivators for a lot of donors. Um, and then specifically early on, education around donation procedures, who's most likely to be a match, maybe about specific steps in the donation process, and giving potential donors really clear and personalized information about compatibility and the evaluation process itself and the surgery can help really increase willingness to donate themselves, or at least be evaluated for donation. During evaluation, really providing structured support. So, navigating donor concerns, including people within the process, such as social workers, peer mentors, people that have gone through the process to really address concerns about the surgery and recovery, um, and really focusing on the transparency of the process, allowing the donor and recipients to have kind of clear conversations um, around the transplant system that may impact their willingness to for donation.